Your stomach, kind of propped up on the shoulders. Your feet can be back at the back edge. So if this was your bed, you're laying in bed.
Yep.
And then just nice and slow, push yourself back into that kneeling, hands and knees position. Perfect. Now, what does that feel like?
Left knee, no issue. Right knee, nothing like the tightness we just did.
Okay.
Just mild.
And so then from there, you would rock back,
Okay.
get to discomfort but not pain,
Yeah, that's fine.
and then you'd shift forward again. You know, let's do like 3 of them.
Okay.
But this way, I mean, think about you're in control. You know what the knee can tolerate, what it can't.
Right.
On a bed, it's much softer than the plinth we're on right
Sure.
now. And then I would go back to kind of propped on your stomach, and then you'll come off the side whichever way you want. So come on over to the recliner. On the side of the recliner, the surgical knee is going to go in the seat. The non-surgical knee will be on the side.
It's going to go into the seat?
So you're going to come in just like this.
Okay, but I'm not going to sit.
No, you're going to kneel. And how does that feel?
Yeah, that's tight. That's the tightest of the three, because I'm guessing I'm closer to my rear end.
Sure, sure. But that gives you, you know, this is what I would do at home.
Yeah.
This gives you a solid, 6 inches of cushion underneath that knee.
Yeah.
Now, if you bring your hip forward a little bit, so you don't have to bend the knee quite so much, you can still get a little bit of pressure, but not as much bend. Okay, so now let's straddle the bench again.
Okay, facing the counter.
Facing the sink, yep. So you're gonna use the inside edge of that sink to do, no, the way you got it, yeah, to do some sit to stands. And
So we
you
do some what?
stand up.
Oh, stand up.
You're just gonna stand up, sit back down. Perfect. And so think about where your knee goes. So the knee translates forward just a little bit. That's perfect. What does that feel like in terms of stress through the knee?
Tight.
Yeah.
Yeah, it feels tight.
So tightness is what we want, pain we don't need.
Yeah, I wouldn't say it's approaching pain, just tight.
So on this one, what I want you to do is keep your feet where they are, but slide your hips back a little bit. And now think about the tightness from there. So stand from that position, more or less.
Let me try it again.
Yeah.
A little bit more right in the, like the core, the center of it.
Okay.
But nothing, it's like 5 and 6.
And then slide forward so your knees actually touch the counter. And let's go from there.
That's a little bit more.
Yeah, I would expect this to be more of a stretch